In today's To Your Wellbeing, we are breaking down what you need to know about flu and coronavirus. That's right. Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snider, is joining us to talk about the flu and coronavirus, all of it together. Okay, so first and foremost, let's just ask, how bad is the flu season expected to be this year in combination with COVID-19?
So Stacy, that is kind of like the million-dollar question. A lot of speculation. Our worst case scenario is that it would definitely overwhelm our healthcare systems. However, based on countries in the Southern Hemisphere who are now in their flu season, the rates are lower, probably due to two components. I think there is still very good influenza vaccine uptake, as well as the fact that people are still being very adherent to social distancing and wearing a mask. And so we are hoping for those two factors to still be really embraced in our state, in our county, to really have making sure people get the flu vaccine, because we really don't want this twin pandemic, right? We don't want coronavirus plus also the fact of having influenza in our community, and anything we can do to prevent it is really what's important.
All right, so that was going to kind of go with my next follow-up question, which it sounds then that flu shots are as important or more important than normal to get them this year.
That's correct. We know that in seasons past, we have the flu uptake of like how many people usually get the flu vaccine is roughly 50%. But right now, the CDC goal is really pushing it beyond 60% in our community. Even we know that the flu vaccine for this year has been reformulated to take into consideration the strains that circulated last year. And there's a good sense that there'll still be part of what's going to cause the flu season this year. But the key thing is we really want to advocate for everybody, right? Anybody over the age of 6 months should be getting the flu vaccine. And those who are older than 65 should aim for the high dose vaccine.
All right, and how soon should people try and get their flu shots this year? I mean, I've already noticed that there are signs up at stores and things of that nature that say, come and get your flu shot now.
Correct. I think a good time to get your vaccine is now. Really the key point is try to get it in before the end of October. It's still hard to tell when our peaks of the flu will be in our community. Usually we see them in January. Sometimes it's a little bit much later than that. So I think just making sure to get your vaccines in before the end of October. And I'm a fan of kind of like right now, if you have the time to put it into your schedule, it's better to do it now before you forget about it later on.
Is it something where you think we might need to be getting more than one flu shot this season?
No, you know what? The recommendations right now is just getting caught up on your vaccines. So, we know that being in a pandemic over the last 6 months, a lot of folks have postponed their general regular visits. Probably a lot of kids are a little bit delayed in their vaccine schedules, and right now is the perfect time to get caught up. And so the thought is just, the key thing is really, if you have that opportunity to get your flu vaccine now, definitely try to get in before the end of October is probably the prime time to get vaccinated. And then in addition to making sure to be very vigilant about wearing a mask in public, hand hygiene, and all this is important for to curtail any viral transmission of other respiratory viruses. So
we need to continue to be doing all the things that we're doing for COVID to also prevent the flu.
Yeah, exactly. I think the challenge is that, when somebody presents for flu and somebody who presents for COVID, there's a very large overlap. And so for healthcare providers, come flu season, they'll definitely take that into their differential of I'm going to have to check you for flu, I'm going to have to check you for COVID-19. And, whatever we can do from a patient standpoint, in order to prevent, to get to that point, you don't want to have to go to the doctor to have a sick visit. And what we can do from prevention is definitely really continuing to adhere to wearing a mask, right? You want to wear the ones that are really well-fitting, across the nose. And then also hand hygiene and social distancing. Those 3 W's are so key for preventing respiratory illnesses.
You talked a little bit about that overlap. Can you maybe clarify a little bit? Because I think people are always wondering what is the difference between flu, COVID-19 symptoms, and other fall ailments like strep or allergies?
That is when we think of flu-like illness, a lot of people, they really remember just feeling so like achy, both in bones and your muscles, having fever. Some people may have a sore throat, but it's really that temperature and the body aches that and occasional cough that really gets you into that feels like flu. And with coronavirus, SARS-CoV-2, that disease process also has those symptoms, but a lot of people also feel like they have a sore throat at first. Sometimes people feel like they just have like allergies, and then it starts progressing to something worse. And so there is a bit of the overlap that happens. The key thing is that if you feel in terms of somebody who has allergies and it just feels a little bit different, it is definitely worth calling up your primary care doctor to be evaluated, or swinging by some of the community testing sites that are available to get tested for COVID-19.
And I think that's really key. I think so often we think, oh, well, it's just allergies, it's not a big deal. But you said pay close attention. If it feels a little bit different, it's worth going to get a test.
Correct. And that's the thing that's challenging about this, right? Is that with COVID-19 illness, a lot of people just have mild disease, but you still can spread it to others. And so when some people may have gotten to, let's say people came to a gathering and had a birthday party, and then a couple days later, they're like, oh, this is my allergies, but then it ends up it's actually COVID-19, and before you know it, you're probably involved in some cluster outbreak and find out that more people had the same symptoms. So it's a very challenging process, and I know that the key part is really being really vigilant with wearing masks and social distancing. Hand hygiene is so important, especially as kids may be going back to school in in a month or so. All that is really important to get into the practice and not lay low on it. I think a lot of people may have a little bit of pandemic fatigue, but this is still the important time to really embrace these public health interventions, because our rates in our community are still high.
Yeah, fatigue for sure. I can definitely second that. I'm sure everybody else at home is feeling the same way. All right, Dr. Snider is going to be with us until 6 o'clock answering your coronavirus questions. Now, you can text those questions. The number is 336-379-5775, and we'll spend the rest of the time answering your text questions.